We do that again. Good evening, everyone. This is Sheena Ali, your Caribbean College Planner and Student Advisor at the Student Center. And welcome to Study Nursing. And this webinar focuses on different programs and various schools offering different types of nursing programs. We are joined by a nice varied bunch of institutions. So we have Daniel. And you guys who follow us on social media should start to know Daniel by now. I was with him in March in Australia at Murdoch University down in Perth, Western Australia. He's going to tell us about some great options. Having seen their nursing programs and speaking to their nursing faculty is definitely a good interesting option for many persons. Then we have Anita McIntyre, who is a veteran to the region and recruiting across the Caribbean from Sheridan College out in Toronto, Ontario, Canada, a school that I've visited multiple times now. Then we have Sarah and Hector from representing Brock University. They are no stranger to the Caribbean, and I am no stranger to Brock. I must admit, I only visited once, and I'm going to correct that soon. We're going to make that happen. Thanks for joining us. And we have Natalia, and we have Kendra, and Kendra is from the nursing faculty at Conestoga, and she's going to be doing the presentation on behalf of Conestoga as the program manager of the nursing program at Conestoga, based out in Kitchener. And I had the pleasure of last year of visiting about 4 campuses, Conestoga in one day. I would not recommend that for everybody to do, but that was my itinerary and I enjoyed it thoroughly. So we're going to talk about nursing and the different programs that these institutions have to offer. So if you're from the Caribbean, and you are interested in health and wellness, nursing is a popular program and is a growing demand for nurses all over the world. So they're not shortages just in the Caribbean where we are, but shortages all over the world. So here are some schools who are going to talk to you now about their programs and what they have to offer. We're going to start off first, but down under at Murdoch University down in Perth. Daniel, you can go right ahead. You're going to share your presentation. Join us on Zoom if you have any questions or comments. You can send them using the Q&A and chat option. For those people in on Facebook, we want to say good evening to you and thanks for joining us. And we'll take a look at any questions at the end of all the presentations. So without further ado, Daniel, over to you.
Wonderful. Thank you very much, Sheena, and a very good morning to you from down under in Australia. It is a bright start to the day. It's actually our winter, so this is why I'm wearing this evening for you. But it is I can attest to you that it is rather cool for Australia. Nevertheless, let's get started. So I guess one of the questions I typically get from these types of presentations is where is Perth? Many of you will know where Australia is, but Perth is a little bit more of an isolated case. So we're out on the west coast. So you can see on the screen the little red dot on the western coast of Australia is where we are located. So we're the only major city on the western seaboard of Australia. So Sydney, Melbourne, Brisbane, those types of cities that you would be more familiar with are located on the eastern coast. So we are approximately 12 hours distance. So we are literally on the other side of the world from where you may be currently watching this particular video. But it's not that far. Sheena made it. I'm sure if you decide you want to come out and visit and spend some time studying with us, you will enjoy everything there is about Perth, Western Australia. There we go. And one of the big things that we like to talk about when you're coming out to Australia is that we are just a giant island. So if you enjoy island time, we have island time too. It's just a little bit bigger than what you might be used to. So on the images in front of you, you can kind of see what I guess the lifestyle of Perth is all about. We have 300 days of sunshine every single year. So the sky that you can see in those images is pretty much what you will see every single day that you are with us. Apart from now in June, July, and August when it's our winter, and we get some rain, we get some overcast skies, but we don't get any snow. So Perth itself ranks very highly in livability and also as a student-based city. And all of this sort of feedback comes to us from our students who come and study here. So if you like the idea of an outdoors lifestyle, you like a cool, dry winter and a hot, dry summer, Perth, Western Australia can really offer an exceptional experience to you. One of the other benefits of coming and studying in Australia is the affordable lifestyle, and Perth has a strong reflection on that. So you can see here on the screen, the cost of living in Perth is actually cheaper than most of our bigger competitor cities around the country. And that makes a big difference because when you are traveling halfway around the world, you do have to be mindful of your budget. You want to make sure that what you are bringing with you can stretch as far as you need to. And we'll talk a little bit more later on in the presentation about how you can actually manage that whilst you are studying. A quick slide on ratings and rankings. Overall, this is fairly useful information. It doesn't necessarily tell you a lot about the program. So I wanted just to throw this up here because one of the things that we do pride ourselves on at Murdoch University is our inclusiveness. So what does that actually mean? Basically, we have 85 different nationalities on our campus. The number one international nationality for us is actually the small nation of Bhutan. So it's a small country wedged in between India and China, and we have approximately 1% of the entire Bhutanese population studying in Perth. Half of those are with us. And so what this does is really, I guess, reflect on the fact that as an institution, Murdoch prides itself on welcoming students from around the world. And then obviously one of the other reasons that we like to encourage students to consider Murdoch as a destination is the financial aspect of it. We realize that the investment that you're making to come and study with us is quite significant. So the university is really invested in returning some of that money back to you in the form of a scholarship. So every student who comes and studies nursing with us is eligible to receive a 20% scholarship towards their course fees for the life of their study. So if you come to us for 2 years, 3 years, 4 years, you will receive a 20% reduction on your course fees across that full duration. There's no restrictions, there's no requirements. It's simply if you are eligible to study with us, you will receive that scholarship. Okay, cool. So in the interest of time, I wanted to kind of give you a broad overview of the different options that we have in our Bachelor of Nursing. So our nursing program only has the bachelor option, unlike some other Australian universities who offer a Master of Nursing as well. Murdoch University doesn't do that. But what we can do within our bachelor option is offer a variety of different entry points. We have 2 different locations where you can study nursing with us. Our Murdoch campus, which is our main campus, the one that Sheena visited when she came to Australia earlier this year, and also our Mandurah campus, which is located about 20 minutes further south of our main Murdoch campus. The key distinction between the two is the actual entry points that you have available. So our Murdoch campus is only available for entry in February each year, whereas our Mandurah campus has 2 options, our February and our July intake. The key difference when you start diving into it there is for many students for anyone who doesn't have a nursing background, our Bachelor of Nursing is a 3-year degree, and that is typically undertaken by students who have finished their high school qualification and are moving into an allied health specialisation. We also will welcome students who are considered mature age, who may be coming from an entirely different background and looking to upskill into a completely different area of study, or perhaps even a related area of study. For any student who has a nursing background or work experience in nursing, we also have a conversion program, which is a 2-year nursing degree that allows students to qualify in a far quicker period of time. You'll note at our Mandurah campus, we have the traditional 3-year degree model and also a 3.5-year degree model. Either option allows you to graduate and become a registered nurse here in Australia, which, as I'll talk about a little bit later on, has immense value. For students who are wanting to come in and are not sure if they meet the direct entry requirements, which I'll talk about in a moment, there are options that you can consider to come and study with us. So on our Murdoch campus, we have our Murdoch College, which is our pathway college that allows students to complete qualifications that will upskill them from a year 11 or a year 12 qualification in the Caribbean into our first year of nursing at our Mandurah campus. So this will be the July start at our Mandurah campus because that aligns the best with the academic year that you follow in the Caribbean. So you can see there are the two different options that are available to you if you were interested in pursuing nursing at the Mandurah campus. Alternatively, we also offer another pathway with our vocational education provider, TAFE WA, and they have the option for students to complete an 18-month enrolled nurse qualification. And on completion of that, you are then eligible to transfer into the second year at our Murdoch campus. So once again, you can complete an 18-month diploma of nursing, so one qualification there as an enrolled nurse, and then transfer into the second year of our nursing program at our Murdoch campus for an additional 2 years and receive two qualifications over 3.5 years of study. So interesting, different options to consider when you're looking at nursing. And then, as I mentioned before, the admission requirements for our Bachelor of Nursing entry, you can see here that these are up on the screen. As I mentioned, most students who come into our Bachelor of Nursing are immediate high school graduates. So for many of you who are doing the CAPE, you can see the grade average that we would require for entry into nursing. But we also do recognise that students don't always follow that high school directly to university path. So if you have a qualification, another bachelor degree that may be equivalent to an Australian, a US, a Canadian, or a UK bachelor's degree, we can also accept that as evidence of your entry. And then we also have an English language requirement. Obviously, as nursing is a very heavily spoken
Oh, oh no.
nurse, as a registered nurse. And that's really important because once you actually finish your studies here in Australia, you are eligible for what we call post-study work rights. And basically what this means is once you apply for post-study work rights, you are eligible to remain in Australia on an entirely new visa for up to 3 years. So you can recoup some of that investment that you've made for your study through the work that you are able to do as a registered nurse. And as Sheena noted earlier in her presentation, the call for nurses around the world is exceptional. So your chances of securing very well remunerated employment are going to be significantly higher. So that wraps up my very, very brief presentation. Thank you so much for your time and very much looking forward to the questions later on in the presentation today. Thank you, Sheena. I'll pass back to you.
Thank you so much, Daniel. Without further ado, I do believe the next person was Anita. Yes, so Anita from Sheridan College, based out in Toronto. She will be going next with her presentation and what Sheridan has to offer when it comes to nursing programs. Sorry, my video was off just now. You're muted, Anita. Sorry.
Sorry, thank you. So I'm going to just talk a little bit about our nursing program. I'm going to start off with where we are located. We have three campuses in the Greater Toronto area in a city called Brampton, Mississauga, and Oakville. All of our health-related programs, including nursing, is offered at our Davis campus in Brampton. All three of our campuses are approximately 20 to 30 minutes by car from the Toronto Pearson Airport, so not too far once you land. Sorry, just trying to switch my screen here. Okay, so we have a faculty of applied health and community studies, and we offer quite a wide variety of different health programs. For nursing, we actually have two different programs. We have a 2-year practical nursing program, as well as a 4-year bachelor degree in nursing. We also offer programs like vet tech, kinesiology, athletic therapy, healthcare administration, addictions and mental health, diagnostic imaging, nutrition, food management, osteopathy. And we also have a pre-health program for students who may want to take a 1-year pre-health program. So I'm going to start a little bit about our practical nursing. So it is a 2-year diploma program. And it is approved by the College of Nurses in Ontario. Graduates, when you graduate from this program, you'll be eligible to apply to take the regulatory exam. And when you've successfully completed, you'll be then issued a license to practice as a registered nurse in Ontario. So what you'll learn in the program. So you're going to learn how to help clients with nutrition, medication, safety. You're going to learn how to chart patients' progress, assess their conditions, care for wounds, change dressings, give medication, learn how to educate clients on promote health and well-being, and care for patients through all stages of a disease, including palliative care. So what I'd like to focus on is the hands-on learning. There's a lot of hands-on experience, which is essential to really prepare for a career as a practical nurse. So in this program, you'll have clinical placements in long-term care facility. You'll complete 168 hours in acute and chronic care hospitals, another 168 hours. And in your final semester, you'll do a 450-hour clinical placement. And then all placements are actually arranged for you. So you don't have to be concerned about being in a new country and trying to find the placement. So they do try their best to find placements close to where you live. So they will do a survey and ask students in the area. Of course, it's not guaranteed, but they do try to help with that. So about our nursing labs, I'm just gonna click on this and it should open up. Yeah, here we go.
Clinical placements. Students in practical nursing also have clinical placements in long-term care facilities, acute and chronic care hospitals, and more from first semester.
So I was just wanted to show you some of our lab space here.
Clinical placements. Students in practical nursing also have clinical placements in long-term care facilities, acute and chronic care hospitals, experienced instructors. Professors are highly qualified registered nurses and nurse practitioners with experience in family care, maternity care, emergency response, mental health, medical intervention, and long-term care. Nursing Scenario Lab. This is where practical nursing students get practical experience in a simulated hospital environment. This space was remodeled in the summer of 2018 to be up to date with modern medical facilities. Artificial patients. These lifelike robots can simulate many different medical conditions or illnesses. By using them, students can practice everything from treating seizures to assisting someone giving birth. Fast track your diploma. Practical nursing students can complete all of their semesters back to back. This means you may earn your in 16 months. The Early Childhood Education Lab. This unique lab is one of the key rooms for the EC.
All right, so I just wanted to kind of give you a sense there for our lab space. Can you still see my screen? Sorry, I can't view my,
we did, Anaida, but we didn't see the video.
Oh, you didn't? Oh, okay. Sorry about that. Are you able to see the presentation right now?
Yes.
Okay, perfect. So the big component is the hands-on experience that you receive from our program, and then also you learning from our expert faculty. So you're really taught by registered nurses and nurse practitioners, faculty who have experience in family care, maternity, emergency response, mental health, long-term and medical care. So again, you're really getting that experience from the faculty. With regards to admission requirements, for the practical nursing program, which is the diploma program, we require a minimum of 5 CSEC subjects. You must have English, math, biology, and chemistry. And it cannot be the human and social biology. I just wanted to stress it has to be straight, pure biology and chemistry. I do meet a lot of students that may not have the two. They have the human and social biology. So just want to make that clear. For the bachelor degree, we require a minimum of 6 CSEC subjects. And again, same, English, math, biology, and chemistry. So we do accept students after CSEC or CAPE. It is a very competitive program. So we are typically accepting students with grades 1s and 2s in those required subjects. You know, sometimes if you have a 3, you may be considered, but basically it's ranked and we're looking at averages for admission into the program. Now, for those of you who may not have maybe some of the science courses, we do offer a 1-year pre-health program, which many students take as a pathway into nursing or some of our other health-related programs as well. So as it was mentioned in the video, you can fast track this program. It does depend on when you start the program. So for students who start in September, it is the 2-year program. So you start in September, you finish in April, you have the break in the summer, and you come back the following September. For those of you who start in January or May, that is the fast track option where you can complete in 16 months. So it's 4 consecutive semesters without any breaks. So again, depending on your preference, there is that option. So this program is offered in all 3 intakes, January, May, and September. Career opportunities. So of course, after you graduate, you can work in a diverse number of healthcare settings, whether it be in hospitals or clinics, long-term care facilities, and so on. So I want to touch a little bit about our Bachelor of Science, which is a 4-year bachelor degree program. Again, similar to everything I mentioned in the previous slides, again, you're going to graduate with 1,600 hours of real-world clinical experience from this program. Hands-on training. Again, you have the labs with the virtual simulation software and the mannequins as well. The other interesting part about this program is if you started in the 4-year degree program and then you decide, you know what, I'd really rather just, exit after my first 2 years, you have that option. So sometimes it could be financial reasons or other personal reasons. So you can actually start and then exit after the 2 years and receive the practical nursing diploma. And if you then decide you want to return, you can actually re-enter into that degree program within 2 years with no bridging required. So sometimes we have seen students who exit and then want to return back. And we actually have these skill building certificates that each year you actually gain in the degree program as well. So in year one, gentle persuasive approach certificate, year two, crucial conversation course, year three, crisis prevention training certificate, and year four is mastering my mental fitness. So again, these are really great certificates that will really help you. Again, career opportunities, again, being able to work as a registered nurse in hospitals, long-term care, public health, and community health as well. And you really are getting that blend in our program of not just the simulation, but you're actually getting the real world hands-on experience in the clinical hours as well. Okay, and I'm happy to answer any questions you have as well at the end after everyone does their presentation. Thank you for listening.
Thank you, Anita, for your presentation about Sheridan and the nursing program options available. So similar to what Murdoch gives you different pathways to the bachelor's, there are some pathways available via Sheridan to their bachelor's as well, or you can just do the 2-year practical nursing program, which offers you a route as well into nursing. So we're going to Brock right now. So Sarah and Hector, you guys are up. So this is Brock University, based out in St. Catharines in the Niagara region in Ontario. Canada is a beautiful area. If you ever get a chance to visit Canada and you go out there, is Wine Valley. So definitely interesting region to be in while you are there, near the infamous Niagara Falls as well. So Sarah, over to you.
Thank you so much, Sheena. And good evening, everyone. Thank you so much for joining the webinar today. And this is very emotional to me because this is my last webinar with the Student Center. I will miss all the webinars with all of you Caribbean students, but I will be here supporting you whenever you have any questions. And on this webinar, I also want to introduce you my colleague, Hector Michelina, and he's going to take over Caribbean, and he will be with you from now on. And again, we are all here answer any questions related to Brock University. So before we start with the presentation, again, thank you so much, Sheena, for giving a lot of information about Brock and especially the location. So we just want to give you an idea of where we are. And we are very close to the Niagara Falls, but we are also very close to Toronto. We are only like 60 minutes from Toronto and about 30 minutes from Buffalo, which is the US border. So we are the only public university in the Niagara region, and we are the only university that is located within a UNESCO Biosphere Reserve. So this is really a truly Canadian environment if you want to live and to experience a Canadian life. Now, we've introduced a lot about Brock for many years. So this time, I just want to spend most of my time talking about the different options of students who want to study nursing at Brock University. So the first option is usually if students want to go to our Bachelor of Science in Nursing, and this is usually a 4-year degree, and that including the clinical practice from first year, and then you will have more clinical practice in year 3 and year 4. Again, this Bachelor of Nursing will require a lot of different subjects, and for Caribbean students, we will require most of the subjects in CAPE level. So the prerequisites for our Bachelor of Science in Nursing will be biology, English, chemistry, and math. And we will need at least CAPE Unit 1 for biology, chemistry, and math, and at least you need to have at least grade 2 at CAPE Unit 1 for those subjects. And for English, we can accept your CSEC results. Now, another option for students who do not do CAPE or just simply you don't want to do CAPE, that is, you can do some online OSSD subjects. And this is just the code of biology, chemistry, math, and English in our Ontario secondary school diploma. Then if you do any of the online OSSD, we can accept it as the prerequisite. But please make sure that all of these subjects must be at least minimum 75%. And again, it's very similar to Sheridan College. This is a very competitive program at Brock. So the cutoff rate at Brock for this Bachelor of Nursing is about 80%. So the overall GPA you need is about 80% out of 100. One significant note at Brock is that we don't have any limitation on the number of international students. So as long as you can meet all the requirements of our program, you will be accepted to the program. And after finishing 4 years of study, you are eligible for the exam to be a registered nurse in Ontario. Now, many students say that, oh, that's too long or that's too difficult for students, especially students from Caribbean, because many of you do not have CAPE. So at Brock, we have another option. This is more like a bridging program for students who have a previous bachelor degree. And this is the program we call concurrent nursing degrees. And this is the program that only lasted for 20 months and in 5 terms. Now, the first option to get into this program is that you complete your first bachelor degree somewhere. It can be in the Caribbean, it can be anywhere in the world. And it should be a 4-year bachelor degree with a minimum average of 75%. And you meet the requirement of some mandatory courses. I listed it here so you can have further look at all the courses. For example, we require introductory psychology, developmental psychology, human anatomy. So those kind of those kind of courses are the required courses to get into our concurrent nursing. The other option is that if you do not meet the requirement to our Bachelor of Nursing because it's too high, the cutoff rate is too high, you cannot get the GPA or you did not meet the prerequisites, you can get into our Bachelor of Science in Medical Sciences. And then after you finish 4 years of medical sciences, you can get to our concurrent nursing. Now, the best thing at our concurrent nursing is that after 20 months, you will get both a bachelor and a master of nursing. So, like in total, if you do medical sciences and concurrent nursing, it's only 6 years and you have bachelor and master at the same time. So it's pretty much the same time if you do a bachelor of nursing and a master of nursing. And of course, this concurrent degrees also lead you to the exam to be a registered nurse in Ontario. So personally, I think this is a more affordable way if you want to study nursing in Canada, just to save your time and save your money. Now, I just want to touch on a bit of the money side of it because many of students are worrying about the tuition fee and all the costs associated when you come to study in Canada. Right now at Brock University, the international tuition fee will be around 39 to 41,000 Canadian dollars. And if you want to stay on campus, the meal plan is included with the residents, and you will spend like 14 to 16,000. So overall, the total anticipated cost will be around 60,000 Canadian dollars. But we have quite a few financial policies that support international students. The first policy is the flat fee policy. That means if you study more than the standard credits, you don't have to pay more money. That will save a lot of money if you can study like at least one more credit. Then you can see here, you can save like 7,000 per credit if you study one more extra credit for a year. And you can save more if you can study more for 1 year. Another financial support is the tuition rate lock. And this means that the tuition fee for year one will be applied for all the following 4 years. We won't increase your tuition fee, even like the tuition fee of the university increasing every year. That will give you and your family a stability in the financial budget, and you know exactly how much money you have to pay for all 4 years. We also have a lot of scholarships. I'm not mentioning all of them here, but I just want to let you know we have some automatic scholarships and we have some competitive scholarship as well. The biggest scholarship at Brock is the International Student Ambassador Award, and it's up to 29,000 Canadian dollars per year. And we also have a special Caribbean International Scholarship for just Caribbean international students. So please go ahead and apply for those scholarships because it's just for you. I think that's it for me. I'm sorry if I spend more than 8 minutes, but I
All
will.
right. It's a lot of information. I give that as a guide, but it was a lot of information. Thank you. Thank you so much, Sarah. And thanks for highlighting the bachelor for nursing and then the concurrent program, which combines the bachelor and the master's program. And you can complete that in 20 months if you have already obtained a bachelor's degree and you want to move up to Canada, you want to do nursing. This is a strategic, cost-effective way to do so. And I have some questions about that after the presentation. So thank you so much, Sarah. And you will be missed. And we look forward to working with Hector. So welcome, Hector, to the Student Center and working in the Caribbean. Looking forward to seeing you at Cup Fest in October. And I'll just put a plug in there. Cup Fest will be heading to Guyana, Barbados, and Jamaica this October. Actual dates will be made available around August, September. So you will know the specific dates when we start to put it out on the Cup Fest website. And now we turn to Conestoga, last and definitely not least. And we have Kendra, who will be presenting. Natalia, I do see you. Natalia is the recruiter across the Caribbean. She's the one that you will see usually on the floor. But we have Kendra from the nursing department who will be presenting about the nursing programs available at Conestoga. Over to you, Conestoga team.
Perfect. Thank you so much, Sheena. So again, I'm Kendra. I am a program manager of nursing here at Conestoga, and I'm happy to go over some of our nursing programs that we offer at the college. So just wanted to mention that although we are not an island, like Daniel mentioned about Perth in Australia, we are located very near to Toronto, Ontario, which I'm sure is known to many people. So many flights fly direct into Toronto from the Caribbean, and then we're about 1 hour by car from the Toronto airport. We do have multiple campuses within southwestern Ontario. So we have Kitchener, Waterloo, Guelph, Brantford, as well as Milton, which is a newer campus. It's about 30 minutes away from Toronto. So a lot of international students do like that it's quite close to the Toronto airport. We do have as well some degree program scholarships. So we have about 26 eligible degree programs that qualify for this scholarship. Each scholarship ranges depending on your average. So as your average goes up, the amount of scholarship that you're eligible for also would go up. So ranging from about 1,500 up to about 2,500. We also have different awards that you can apply for as an international student while you're here studying at Conestoga. So some available programs that we have, certainly different pathways that you can accomplish whatever your goal is. So the first one I would just wanted to mention is our personal support worker program. This is a very popular program for folks who are interested in healthcare, but perhaps don't have the requirements to get into our specific nursing programs. A lot of the times what students will do is start out as a personal support worker and then work as a personal support worker after they've completed the program and bridge into perhaps our practical nursing program, and then go forward and bridge into our Bachelor of Science nursing program. It's a nice way, especially if you have a family or mature student, that you can actually fund your education and work while going through to more education. So that's one of our pathways. If you already have your degree as a nurse in your home country, you could be eligible also for our enhanced practice for internationally educated nurses. This is a 2-year program that orients you to the Canadian healthcare system. It includes lab theory as well as simulation and clinical experiences that you're able to hit the ground running, so to speak, and start working as a nurse here in Canada or here in Ontario once you've completed that program. Another newer course that we've also introduced is our transition to nursing practice. So there have been some changes of the College of Nurses Ontario in regards to what you need in order to register as a nurse here in Ontario. I would take a look at that College of Nurses of Ontario website to see if you may qualify for this transition to nursing practice. The nice thing about this program is it's asynchronous online, and folks would be able to then practice as a nurse once they've completed this transition. So those are two different options there. We do, like I mentioned, have the practical nursing as well as the Bachelor of Science. However, it's unlikely that you'll be able to enter it right from your home country. You may need to do, like I said, the PSW program and then bridge into the practical nursing or the Bachelor of Science. Or as another option, we do have our pre-health science pathways where you would complete a 1-year certificate, mostly comprised of the things other folks have already talked about: biology, chemistry, math, those sorts of subjects. And then you'd be able to go forward into the practical nursing program for 2 years, or the Bachelor of Science in Nursing, which is 4 years. I also just wanted to mention that we do have a program called our Nursing Leadership and Healthcare Management. This one doesn't have a clinical placement attached to it, but this would focus on careers that are more of a managerial position, say, for example, in hospital long-term care settings. To give you an idea of careers that are available based off these programs, I would say obviously PSW, practical nursing, registered nurse, and like I said, managerial positions within hospital. Usually ranges of salary, I would say, could be as low as 40 to 50 per year for, say, at PSW, and then up to greater than 100,000 per year for more of those managerial positions. So entry requirements, I talked a little bit about this, so varies by program. Some programs could be direct from high school or just a mature entry. There is some sort of English requirement. It will depend on what your schooling has been back home, depending on what is equivalent. As well, I'd just like to mention that there must be some sort of willingness to obtain immunizations in order just to attend our clinical placement. So all of our nursing programs, except for that leadership one I mentioned, does have a clinical component. So you would just need to make sure that all your immunizations are up to date. That's something you can work on once you've been accepted and come over to Canada, and we'll be able to offer you support for that while you're here. So why choose Conestoga? So one of our biggest things that I like to talk about is our facilities. So we have simulation learning, hands-on lab and clinical experience, as well as innovative technologies such as anatomage tables, which I'll talk about in a moment here. So this space that you can see above, this is one of our lab spaces. Each program that I mentioned in our nursing has a combination of theory, lab, simulation, and clinical learning. All of these programs, I would say, start heavy on the theory and lab and then proceed more into those simulation and clinical experience. So this is a picture of our lab space. Labs are where students would learn their hands-on skills, such as things like catheterization, wound care. Lab sizes are typically around 12 students with 1 instructor, makes it for a nice learning experience for the student. This is an example of one of our simulation learning spaces. As you can see, it looks like someone's apartment or someone's home environment. These spaces are where we would often hire someone called a simulated participant. Basically, they're a paid actor who act as a patient. So they might act out different scenarios. For example, maybe you're working as a PSW or you're a nurse and you knock, knock, and come into this room and you see the simulated actor laying on the floor. Perhaps they've just had a fall, and you're working to navigate that scenario. So, what would you do if you were working as a PSW or a nurse? How would you navigate that? Would you maybe call EMS or ambulance? And then what would you do going forward from there? So, say, for example, you did call ambulance, then we could transport the patient from this area, which is simulated to be their home, into our hospital simulation, which brings me to my next photo. So here we have a picture of our hospital area. So you can see on this side of the window where we have those three computer monitors, this is more of like our control room. So this room would be operated by a registered healthcare profession, such as a registered nurse, respiratory therapist. They would be operating our mannequins that reside on the other side of the window. So if you're on the other side of the window where you see that mannequin laying in bed saying thinking nursing, this side of the room would be students are in there interacting with their mannequins. So maybe, for example, you are a student and you are saying, "Hi there, how are you doing today? Are you having pain? How are you feeling?" And then the person on the other side, on the control side, is saying, "Oh, nurse, I don't feel so well." And then you're interacting to see what you can do to help that patient. So as you interact with the mannequins, they respond based on how well you do. So if you maybe give them the wrong medication or you don't give them oxygen when they need it, they will react appropriately. So maybe they become unresponsive and you have to navigate that. Or perhaps you've intervened appropriately, they improve and then go forward from there. So I would say students typically are very nervous to encounter these types of situations, but they always say that they learn so well and that they really benefit from this sort of learning. It really gives you kind of that experience to get that real life learning without that negative consequence of perhaps harming a patient. So really bridging that gap between lab, where you learn all those skills, and clinical, where you go out to actually meet real patients and interact with real patients. So my next slide here, I do have just an example of our anatomage tables. So just starting those videos so you can kind of look at them while I'm talking. Anatomage tables are highly advanced, life-size 3D anatomy visualization system. Essentially, they function as dissection tables without actually having physical specimens at your fingertips. The table is basically loaded with real cadavers, so folks who've donated their bodies to science. The table is basically able to dissect at a touch of a button. We can then get those items back if we need to. So you can look at muscles, organs, bones, blood vessels without the need for those real specimens. It's new state-of-the-art technology that we've been integrating into our healthcare program. So it's been a very popular type of technology that we've been seeing at the college recently. All right, so just wanted to briefly touch on some supports we have. So counseling, medical care clinics, we have some student financial services with award opportunities, like I mentioned. We have student success advisors, as well as our international student immigration advisors that are really helpful when you're thinking about things like your visa and navigating different kind of study permits, work permits, all of those sorts of things, as well as some additional services there, student rights and responsibilities, gender-based violence support, accessible learning if you require any kinds of assistance when you're doing your testing, for example. And then lastly, there I have some career advising. And then I just wanted to pop up that QR code. So happy to just take a brief second if people want to capture that. This will just lead you right to our health and life sciences program, where you're able to see all of those programs I talked about, as well as some more, and then look at what those admission requirements are. So thank you so much for taking time, and I'm happy to answer questions after as well.
Thank you so much, Kendra. And I remember taking a visit to see the labs at Conestoga, especially the size dolls that look technically real.
Mhm.
There was one of a elderly looking person So I found that quite interesting. So I have some questions and I'm going to get straight to it so that we can end on time and let you good folks go. So once again, thank you so much for your time and giving us some insight on the programs available. And for those of you listening on Facebook and for those of you in the Zoom, please note that Cut Fast Education Fairs, the in-person fairs will be coming again, featuring some of these schools that you see on the panel here today. We'll be making in-person stops in Guyana, Barbados, and Jamaica this October, and more on those dates will be closer to the time. So those dates will be up on the website around the end of August, early September, so you can plan accordingly. Now, everyone would have provided us with insight on those coming from secondary school, with some persons also mentioning others with maybe a degree already. But in the Caribbean and in some other countries, you will have persons that attended a two-year college who may have an associate degree in nursing, or they will have a two-year diploma from a university or a college in nursing. Are they able to consider your programs as well? And in that case, since they are coming from another post-secondary institution, would there be room for them to be eligible for any transfer credits or course exemptions? Anyone that can answer can start.
I can start with that. Just like with all of our other programs, it would be something we would look at. The student would have to apply first as a year one, semester one student, and then they can apply for advanced standing credits. So they would have to submit a copy of their full transcript, the course outline or syllabus of what they've taken in their country at their college or university. And they would be able to self-identify any courses that they feel that they have already taken. And then they can apply for any type of advanced standing any credits.
Thanks. So they would apply first for year one, and then afterwards submit course outlines and documents to as evidence that they could be potentially assessed to see if there's any alignment with what they've taken before. With you.
Yes.
Okay. Thanks for that, Anita. And that is particularly for your bachelor's program and not necessarily for the diploma programs, correct?
It would be for all of our programs that we would do that for. Yeah.
Okay. Thank you for that. Natalia, you next. Go ahead.
I think you're on mute. So I just want to add, same like Sheridan, I just want to add what that we recognize some credits. It will have to, we have to assess by the credit transfer team. But just to put a little bit of context to the Korean people, the Canadian health system is different than sometimes the system that you're used to in the islands. So that's why, for example, for our nursing program, it doesn't matter if you're a doctor and already practice in Caribbean, you have to do, for example, the pre-health because it's an introduction to what is the Canadian system looking like. And you will learn during these 8 months valuable information that will help you to understand how does it work the system in Canada. So I encourage you to for those who want to study nursing. I remember back when I was in Barbados or when I was in the Caribbean, nursing is very popular. So please register and we can analyze as Sheridan said one-on-one basis.
Thank you, Natalia. And that is a good point because nursing is a regulated profession. And so I know every jurisdiction may have different rules and how they will attend to it. So thanks for making that point. Hector?
Yeah, no, I was just going to add that similar to Sheridan and Conestoga, the number of like transfer credits students can get with previous secondary education, post-secondary education studies are very limited. So it will be assessed on a case by case, sort of like way, but yeah, no, they can certainly apply as a first year student and we'll do the assessment once we receive all the documents that have been discussed previously.
Thank you so much. Danielle, I know you're completely in a different jurisdiction, so nursing in Australia might be different. Anything or you're not, you want to add here?
Yeah, I mean, I think in the Australian context, it's very much, I guess, the reverse of what my colleagues on the call have suggested today, where we would do the assessment pre commencement of your study. So basically, we would tell you up front exactly how much advanced standing you could receive based on your academic background and your work experience. Uh, I think from a work experience standpoint, if practitioners are coming through, we would be looking for a minimum of 2 years work experience, full-time work experience, to be able to use that as, I guess, as a case for advanced standing. So a little bit of a different interpretation on what we've just been discussing.
So in the case of Australia, you would do that assessment prior to commencement. Basically, well, in can most Canadian schools, it might be a after the fact thing, depending on how they view your course outline. So depending on what you're open to as a preference as you plot and plan your strategies when you're exploring different programs, especially if you're considering outside of the Caribbean. Um, do your due diligence for sure, and you might want to be open to, see how different destinations treat to your credentials. I have a question here from Sel. His question is for Daniel. Okay. In reference to the IELTS that is required, if you are from an English speaking country, do you still have to take the IELTS?
There are There are alternatives available. It depends on where your academic background is. And obviously, the traditional English-speaking countries don't include the Caribbean islands, primarily because Australia doesn't necessarily receive a huge number of Caribbean students. So there's not the historical engagement with those markets. Now, it doesn't mean that IELTS is the only test, or the only way to demonstrate your English. We are open to exploring those, so please don't be put off by that. It is just simply a useful benchmark that I put into all my presentations because it gives everyone a sense of exactly what is required. Uh, the longer answer is, in order to register as a nurse in Australia, you do need to have an IELTS test result if you are coming from a non-English speaking background. So we would be able to talk through that in a little bit more depth at a later date if that was something that people wanted to consider.
Thank you, Daniel. So, Sal, that's not a typical yes or no question, but you are encouraged. So, what we usually tell students is they will submit their CSEC, and typically, the English A is the benchmark that will be the equivalent in different destinations. So, um, usually, that is not a requirement at the point for admission for most schools, but especially if there's not a huge pipeline of Caribbean students going, you still have to build the precedent. So it will be a case by case basis. So still, if you are interested in Australia, definitely think about it. You can actually reach Daniel via the Cut Fest directory on our website. So you can send a more detailed message to him. They have a dedicated page. You can think about it. But yeah, nursing will be an attractive standpoint there. And I'm not sure which country you're from, but definitely reach out to Danielle for more information. So when it comes then, let me just go back to basically everybody's entry is really a case by case basis if you're coming in as someone with an associate degree. So you will need to really have your course outlines for review. In the case of Australia, that might not necessarily be a thing. And then with the IELTS, it's a case by case for Australia. But I know for Canada, that's not necessarily the case for Canada. So I have another question. So I know that there was a statement where I think Anita it might have been you, where you said all the clinical placements are organized for our students. I want to know to the entire panel, is this the case for everybody when it comes to your clinical placements for nursing students? I see
So just
on it, but it'd be nice to hear like, yes.
yeah.
Everybody say yes.
Is that the case for everyone? Everyone, they get assistance
Yes.
with finding placements and allocation when it comes to the clinical placements. Okay. I have a specific, thank you for your answers. I have a specific question to Conestoga. Kendra, you would have mentioned the EPIN, the that you know which program I mean for those transitioning, those who are
Yep.
educated outside of Canada. Is that program pegged to the registration exam? So from that program, can they take the exam to become a registered nurse?
Yep, that's correct. So as long as you have a 4-year degree in nursing, then you would be eligible to apply for that program, EPIEN. And then following that program, you would be eligible to write your NCLEX exam, which is your registration exam, to become a registered nurse in Ontario. So yes, it is linked. There is actually a course in your final semester, that we prepare you to write that exam.
Okay. Well, thanks for confirming that. So,
Mhm.
for those of you, because right now in the Caribbean, a lot of the community colleges that used to offer the 2-year associate degrees have transitioned into offering full bachelor degree programs, which lead me to my next question to everybody. So we're a British pattern style system. So our typical universities have 3-year degree programs, while some of the community colleges that offer bachelors might have a 4-year program. If someone's coming with a 3-year, how would that work for you guys? For those of you who might have programs for which a degree could be a requirement. I think, Brock, this might be a good answer for a question.
I I was going to say, like for our concurrent Bachelor of Nursing, Master of Nursing, it has to be a 4-year degree, unfortunately. I think I would never discourage students from like still reaching out and trying to, like confirm their, again, specific case or circumstances. But generally, speaking for concurrent and Master's degree in nursing, it would have to be a 4-year bachelor degree.
So what if they had a UK nursing degree? And it's similarly, nursing degrees in Australia are 2 years. So how,
You know, so far I haven't encountered that situation, so I would have to like consult with our faculty and admissions department. But I don't know if Sarah, you have had a similar question in the last couple of years. Okay, so yeah, we would have to like just do it case by case in that particular scenario. But we're happy to reach out to our faculty of applied health sciences and nursing department and our admissions department to just check.
okay. All right. And that's, thank you so much, Hector, for that. So good, just something to note because some might have 4 years, which can work, but then the reason why I asked is because a year or so ago, we had a student that was coming from UWA with a background in psychology that may have been thinking about it. So sometimes in your degree, yes, you can take the science courses alongside what you are taking. So just thinking about those type of students, because people change their mind. They might start off in one area of study and then they decide, well, no, I want to do this afterwards. So we've been seeing some of that coming in a little bit. So just thinking about it for future purposes. That's why I asked the question.
Thank you.
All right. My next question is for Danielle specifically because you kind of have a different intake to everybody else. So your semester one is February, and then your semester two is typically July. When and how if you're applying for a February program, when should the student apply to you?
Yeah, we always recommend at least 6 to 8 months ahead of your start date. So if you're looking at a February start in Australia, you probably be looking around now, June, July, August of the year prior to when you want to start. And the process doesn't take that long. It's more to give you a decent runway to make all of the, I guess, the preparations that you need to make. So applying to the university is just one part of your decision to go and travel and study abroad. Obviously, then you need to work through all of the challenges of getting a visa, planning your airfares to and from where you're going to live, all of those sorts of things. So giving yourself a longer runway does actually help.
Okay. Well, thank you for that. I know everybody else is typically a September, some may have a January start. Um, so you have to 6 to 8 months prior to start date. And is good to come in February in Australia. February, March, a good time to come is their summer. So you don't have to worry. But their winter isn't bad. It's not a Canadian winter. So for those of you, me having lived in Canada for a couple of years, you know, winter in Canada is not a winter like in London or in the US. So come prepared if you are going to a country that experiences a Canadian winter for sure. Natalia, you had your hand up. Yes.
Yeah, so just well, actually, I was gonna say something else, but what you said reminded me to this movie, Cool Runnings. I don't know if you have seen it, that's hilarious. But anyway, just want to tell you that, for example, there are programs like personal support worker or pre-health that we have. Personal support worker have three different ticks, so January, May, and September. For example, the pre-health is starting in January and September, and there are other ones that only starts in September. But most of the ones have two intakes. Our vacations tend to be summer, like it's from April to August, but it's a good experience. I always say to people from when I go to the islands, it's like it's I'm here, it's very humid, but I feel the AC everywhere. So whenever you're in Canada, I just have to tell you, enjoy every season because here you can really see in fall the leaves falling. And I'm from Mexico, but I learned to enjoy the winter, learning how to ski and or snowboard or something. So it's a different experience that I guarantee you we're gonna love and enjoy.
Well, yeah, winter is interesting, but there's nothing like a Canadian winter and first-hand knowledge of that for sure. So definitely start differences. But I want to take this time now. I want to thank you to our panelists this evening for your time, for your contributions. Thank you for fielding the questions very well and providing us with a lot of great insight. I hope persons take this time between now and when Cup Fest starts to really think about what they want to do. If you're thinking about nursing, which is a growing field and will be much more in demand as time goes. Sorry, let me just stop here. We have one more question. Daniel, this is back at you. Thanks for the clarity on my first question, Daniel. Oh, you're welcome, Sal. I have a question for Conestoga. Where can we see information or requirements for the personal support worker?
So everything's in the webpage, but if you guys want to touch base with us, I can guide you towards it. And basically, yeah, it's I have I don't know if I can share a screen here quickly. So I have these admission requirements for the Caribbean specifically. So for personal support work, it just has to be CSEC, honestly. So it's not that difficult. So just touch base with us or in the webpage of the program are posted the requirements. And just to add, those programs in health are really popular. And I want to say, please register 8 or 11 months in advance. As soon as we tell you that it's open, please do it because the seats tend to finish quite fast.
Thank you, Natalia, for that. So I think right now I'm over by a couple of minutes. So, we like to keep things pretty much on time. So thank you, Sal, for your questions. To those who peeped in on Facebook, thank you so much. We appreciate your time and energy given to us this evening. I want to thank all my panelists, Daniel, especially for waking up so early to be on here. We wish you a very pleasant day out in Perth. And a productive day and enjoy your upcoming weekend. To everyone, thank you so much as well. Have a good evening and enjoy dinner. This will be our last theme webinar for now, and we will restart our theme webinars from September. So from September, we start back with the usual theme webinars, and we have more to cover from that time. And then remember that Cup Fest in-person fairs will be in October, making stops in Guyana, Barbados, and Jamaica. And we've gotten questions from persons from other islands, but more to come. Maybe in spring, we'll be able to get to some of these the other islands, the OECS. I'm from Barbados. I'm from a small island anyway. So to all the other small islands like ours, we'll be able to get to you sometime. But we have online, and you can see these schools on the CUP Fest International website. And This video will be made available on our social media platform within the next couple of days, including our YouTube channel as well. And feel free to reach out to any of the reps that you saw on this panel this evening. For those of you who might still want to nip in an application, we have our upcoming monthly Cut Fest application virtual session at the end of the month. That will be the last one until September. That will be on July 30th at 6. You can feel free to come into the meeting room and get some guidance on any schools that are listed on the CutFest website that you may want to apply to. Thanks again, everyone. Enjoy your evening. Take care.